Also in your health, an exchange program through Hartford Healthcare now has more knowledge on the growing use of opioids and their impact on childbirth. Here to tell us more is a member of that team, Kate Sims. It's great to have you with us.
Great to be here. Thank you.
You took this trip, and what did you discover?
So we took a trip to South Africa. It's actually a vocational training team that we do with the Rotary. And we traveled there, 5 of us, 2 doctors, someone from DCF and DMIS, to really look at the effects of fetal alcohol during pregnancy. As we know, in South Africa, they have a much more devastating problem than we do because their history is about they used to pay farmers. The farmers used to pay their workers in alcohol. So they have a significant issue with fetal alcohol spectrum disorder, which is both emotional and physical ailments from drinking alcohol during pregnancy.
So what did the research bear out?
So the research, what showed us for America is that we don't do enough research on alcohol. What we do know is alcohol is the first pathway, right, to drug addiction, but we don't do enough research on that. We don't test during pregnancy. We don't research during pregnancy. So South Africa is much further ahead of us in their research perspective.
And because they are much further, what impact does that have?
Unfortunately, their poverty is also something like we've ever seen. So their poverty actually hinders them from making progress in this area. What we took home was the knowledge base that we have to pay attention more. Our OBs are going to look at, more testing, more research, and really the significance of making sure that we tell everyone no alcohol during pregnancy.
If we do that, that's going to make a huge impact for us here in the United States.
Absolutely. Huge awareness, right, is that no amount of alcohol is good during pregnancy. There used to be, have a glass of wine or red wine, absolutely no alcohol. There's different factors during your 9 months of pregnancy that alcohol can affect something different during each one of those stages. So we learned so much valuable information while we were there.
So now you have to educate everybody else about this, because it's not something we've heard before. We have, but not quite to this extent.
Correct. We pay attention to neonatal abstinence syndrome, which is really about drugs during pregnancy, but we really don't ask a lot of questions about alcohol during pregnancy. So it's a huge awareness for us looking forward, and much more work to do in that area.
What impact does it have on the baby if the mother has too much of this alcohol?
Yeah, so there's different stages, right? So fetal alcohol spectrum disorder can be anything from slightly emotional to physical disorders. It could be cleft lip. It could be facial disorders, mental. So we've seen, when we were in South Africa, we've seen a little bit to a major amount of effects, much more than we see here in America. Again, because of their issues with alcohol, they see much more defects than we do.
Kate Sims, thanks so much for raising awareness. We appreciate it.
Absolutely. Thank you.